All right, guys. So in this video, we're going to talk about small vessel vasculitis, and there are four of them, and each one is going to be associated with a letter. And so each letter will give you the associated areas that are affected, um, and kind of help you figure out the symptoms and what else is involved. And it'll bring everything together. So let's get started. So the first one is Wegener's granulomatosis with polyangiitis. So Wegener's is just someone's name. Granulomatosis just refers to formations of granulomas in the areas that are affected with with the disease. And polyangiitis just refers to multiple arteries that are affected, right? Poly meaning many, angiitis meaning vessels. And so we have Wegener's granulomatosis, or you can say Wegener's granulomatosis. And the C, as you can see that we included here, is going to refer to the distribution of symptoms that we have with this disease. And so what we did is we added a C to this picture to show you that the nasal passages, the lungs, and the kidneys are all affected. And if you draw a big C, that's what would intersect. This is the distribution of symptoms that we see. So again, necrotizing granulomas forming in all three, could be two, could be three of these areas. And again, it's associated with C. ANCA, so that's really important to know. And again, you can remember it just with the C mnemonic. So the letter here is going to be C, obviously. And then this is usually affecting middle-aged men. And so we'll have upper respiratory symptoms. So maybe nasal septum problems, sinusitis, otitis media. Lower respiratory symptoms, so the lungs. So coughing, shortness of breath, maybe even coughing up blood. And then the last one is kidneys. And so you'll see, maybe blood in the urine with rapidly progressive glomerulonephritis, and that's because of the granulomas that are forming there. So again, it's necrosis, granulomas, C. The C is affecting the nasal passages, which is upper respiratory, the lungs, the kidneys, things like that. And the treatment is again starting with the C: cyclophosphamide and corticosteroids. Okay. The next one is microscopic polyangiitis. And with this one, we're going to go with the letter P here. And so this one's sort of like Wegener's, but there's no granulomas forming in this disease, and that's very important to know. So, but there is necrosis, and it is a vasculitis. And again, this one's P. ANCA. So again, remembering the P here. So the P, the reason why we're remembering P here is because it's polyangiitis, so meaning multiple vessels that are inflamed and infection. And the P is distributed here for the lungs and the kidney. But you see we left out the nasal passages and the upper respiratory because usually those aren't affected. And so another P here is for the palpable purpura that you'll see on patients when they present. And so that's another thing that's really important to remember. And sometimes you'll see on biopsy medial fibrinoid necrosis with neutrophils. And the treatment is similar to Wegener's, so it's cyclophosphamide and corticosteroids. And then so for eosinophilic granulomatosis with polyangiitis, or Churg-Strauss syndrome, for this one, we're going to remember the letter E. For eosinophilic, just means a lot of eosinophils. Granulomatosis, which means granulomas are forming, and polyangiitis, multiple blood vessels affected. And sometimes you'll see this as Churg-Strauss syndrome, but they're the same thing. And so we have our picture here of the heart and the lungs, and the letter E because the E distribution is affecting just the heart and the lungs. At other, like the kidneys and other things, organs can be affected, but I think the most common are going to be the heart and the lungs here. And so you'll see necrotizing granulomas forming with eosinophils. Again, very important eosinophils. And what do we know that's associated with eosinophils? So with the necrosis is the fibrinoid necrosis. And that's just the type. But again, associated with the eosinophils is IgE. So you have increased IgE, and it's very associated with asthma. And so you can see how these three kind of go together, right? And so it's just an easy way to remember with the E here that it's affecting the heart and the lungs mostly. It's eosinophilic, so IgE is increased, and and that's very highly associated with asthma. And the ANCA that's increased in this disease is P-ANCA. And so here is just a picture of the palpable purpura. That's just like the wording that sometimes you'll see to explain the symptoms that patients present with. So that's also important. And so the last one is Hinoch Schonlein purpura. It's really hard to pronounce, but it doesn't matter because all we have to remember is the letter that's associated with it. So in this case, if you can guess, it's going to be the letter A because this is an IgA vasculitis, meaning you have immune complex deposition of immunoglobulin A causing the vasculitis. And so most commonly you'll see this in children, and that's really high yield and very important to know. And you'll see these palpable purpura. And the way you can remember that it's A is A stands for ass. And when patients standing away from you, their ass is facing you, and you have the letter A kind of in the shape of this patient's legs when they stand like that. And so you can remember the letter A causing these palpable purpura for the IgA vasculitis. Again, it's most commonly found in children. And these children present with GI pain, bleeding, joint pain, and hematuria. And it usually happens after an upper respiratory infection. And then the abdominal pain that they come in with is usually associated with intussusception. And intussusception, if you remember, is associated mostly, in children that can a lot of the times present with this. And so that's another way you can remember that intussusception is associated with IgA vasculitis because of its association with children. And the treatment in most cases is self-limited. So you would just wash the patient, and then if it gets worse, you would give them corticosteroids to treat. And that's it. So thank you for watching. And yeah.